Nanje Rulala Kwagala, and I'm going to take you through the investigations of liver abscess. So basically we want to do both laboratory and imaging investigations. Like my colleague Dr. Pamela has said, under the laboratory investigations, you'd want to do a full blood count and also liver function test. She's already talked about that, where you see the liver enzymes will be elevated, and then also the bilirubin, like in our patient we saw it was a bit high, and then also the albumin level, which will be low in most cases because the liver has these masses that are infiltrating it, the abscess, so obviously its function will be compromised. And then the CBC, or full blood count, will show you an elevated white blood cell, and then the hemoglobin will be low. There will be an anemia. And then for also still under the liver function, when you look at the coagulation profile, in some patients there's an elevated prothrombin time. And then also we want to do blood culture, which will be positive in 50% of cases. But for our patient, it didn't grow any organisms. And then also culturing the abscess fluid to establish a microbiological diagnosis. Then other tests that you'd want to do, CRP and ESR, which will be elevated because we have inflammation going on, and these are inflammatory markers. And then also, because one of the causes is you're thinking of interamoeba histolytica, so you may want to do enzyme-linked immunoassays. Also, a stool analysis would be very, very important to rule out other causes of the abscess, and also to rule out other conditions that could present like a liver abscess. And then other tests basically are just to identify the cause and to also rule out any predisposing factors. So you will want to rule out tuberculosis, you do a gene expert, typhoid antibodies, which we did and were negative, and the rest, as you can see, how they are outlined. And then for the imaging studies, I'll talk just briefly about them. Then our colleague from the radiology department will further go into detail because he's the expert. But for the imaging studies, an ultrasound scan is very important. It's the radiological modality of choice, and it's diagnostic in more than 90% of cases with 80 to 90% sensitivity. And it helps us to assess the size and the number of liver abscesses, and also it gives us a close evaluation of the biliary tree, like maybe rule out any tumors in the biliary tract or any other thing that could present as such. So it also helps us to give us more information in that regard. And then what you'll see is hypoechoic areas, more than 1 centimeter with irregularly shaped borders. And then also you can see internal septations or cavity debris. All these are findings on ultrasound scan that can point to a liver abscess. Then there are benefits. One, you can do it on the bedside. At the bedside, for example, if a patient is very sick and you can't transport them maybe for CT or any other investigation, then you can do it easily as a bedside test. And then it also helps for therapeutic drainage, which my colleague who is coming next will go into detail, and also which the radiology team shall help us understand better. Therapeutic drainage with ultrasound scan. And then it's also good for follow-up, for example, to see if the abscess is getting bigger or there's resolution of symptoms. And then the limitations is that one, it's operator dependent. You have to know how to use it. And then also, depending on who is actually carrying it out, you may get different findings. So it's very operator dependent. And then very small abscesses may be missed. All those lying in areas of the liver, difficult to examine. Then CT scan of the abdomen with contrast is also an imaging modality of choice with a 95 to 100% sensitivity. And what you'll see is a sharply demarcated mass, which is hypodense to the surrounding parenchyma. Yeah, so you will see like, I think I have, yeah, there's an image there of a CT scan showing the abscess. So you can see it's hypodense compared to the surrounding liver parenchyma. And then the benefits of CT is that it's non-invasive. Okay, sorry. Yes. Yes. So a CT will also help us to evaluate what an ultrasound scan may miss. Then other imaging studies, we have hepatic scans, which use radioisotope material, and depending on how the increase in uptake or decrease, it can help to show you that there's a lesion in the liver. However, the challenge with them is that you're not able to distinguish if it's a tumor, a cyst, or an abscess. So you end up needing a confirmatory procedure. Then other modalities, still these ones are now more of the intervention radiology, which my colleague is going to look into. Thank you.